Ladies and gentlemen, we're in Greeley, Colorado, the beautiful Greeley, Colorado, with Miss Roxanne Lopez. She is a local speech specialist, speech therapist, is that right?
Assistant, speech therapist assistant.
Yeah. And so the topic today for Topics with Mr. Javadi is speech therapy. That's something that is rather big in our society, and there's a lot of need for it, and she's, very good at doing what she does, so we thought we'd ask her some questions about that and, just inform the audience about what speech therapy involves and to what to look out for, etc., and so on. So, but before I get going on any of that, I'd just like to kind of remind everybody to like and subscribe, please, Topics with Mr. Javadi. It just really helps me out to grow the channel. And with that, I'll go to Ms. Roxanne. Will you please introduce yourself to the crowd and let us know who you are.
As you said, my name is Roxanne Lopez. I have been a speech therapist assistant for going on 15 years.
Wow.
Started out in home health in Dallas, Texas, and then moved into the school district in a preschool. I did that for some time, and then moved to Colorado and got into the school district, but not as a speech therapist. However, I was still using my skills in special education.
I see.
And then moved into private practice, where I've been for 6 years.
Wow, that's fantastic.
It's extensive, yeah.
Yeah, and we, of course, have met you through Aspen Speech Therapy.
Yes.
My daughter Hannah and my daughter Mira, they attend your clinic, and you are working with them and have worked with them. And so just first-hand experience, we've seen how great you really are in what you do.
Thank you.
So fill us in on, just exactly what it is you do at the clinic and how you go about helping kids.
Okay.
Yeah.
With Hannah came with some behavior, some negative behavior. So that's the first thing. You have to kind of be patient with curbing and shaping that behavior in a more positive setting. And she was just so hesitant, didn't want to do anything. And so I had to take the time to get to know her and her get to know me. And for a long time, for about a couple of weeks, because I was seeing her twice a week. So there was probably 2 weeks where she needed this space, and so I waited for her to come into my space to be able to engage with her on her terms. So you have to build the trust on their terms first before they will ever do anything, and that's how slow it was with Hannah. And then once we built that trust, she began to start to do what I wanted her to do, as far as look at me, watch me, do this. And then we got some speech sounds. Then we went to words, and then we went to sentences, and now we carry conversations.
Fantastic.
It was amazing, yeah.
Yeah, quite the growth. So what is... just for those who don't know, and may not know, what is speech therapy?
Speech therapy is a service that helps people with, I help with kids. Haven't worked mainly with adults, because you need a speech therapist for the adult part, with TBI, like a traumatic brain injury, or stroke, things like that. I work with pediatrics to high schoolers who have a speech delay, speech impediment, or some kind of diagnoses of special needs, as far as like a cleft palate or autism, ADHD. And autism, that's a big umbrella. But we're seeing more and more people, more and more children with autism. And unfortunately, there's such a need for speech therapists in the school district, because there's just a high need for that. And the teachers are having to have to figure out how to work with this population, and I'm not sure there's enough training to provide for that, because it comes with behavior too. When kids have a speech delay, or they don't have, or they're nonverbal, you sometimes come into the tantrums or the obstinate behavior of, I don't want to do what you want me to do, and I can't tell you, so I'm just going to scream and yell until you give me what I want. So there's that. So there's a lot of behavior, negative behavior in our school districts, and unfortunately there's not enough training to provide for these children. So that's why you get a lot of behavior.
So a lot of patience, I take it, is required in this field.
Oh yeah.
And there's a number of techniques I know you have used, which we'll talk about in a little bit. But I guess before I get to that, let me just ask you this question. And that would be, how did it all begin for you? Where did you start? Did you always have the interest in working with people in this regard, or no?
No, it happened quite by accident, actually. I was in college, and I was in a difficult situation to where I needed something. So I went to college, I opened the brochure, and I saw communication. I can do that. I was thinking it was going to be like speech, where you would train how to give speeches and how to, be a public speaker. No, it wasn't that.
Which, by the way, she's also good at.
It was such a eye-opening experience that I thought, I can do this. This is something that I think I want to do, because you're not only working with the children, you're working with the parents. And you're helping the parents get on board. And so we're all working as a unit.
As a unit, yeah.
Yeah. In private practice, the ability to do that is high. Unfortunately, in the school system, it's not, we don't get to see the parents very often. So, and it's group therapy. But there's such a high need.
Yeah. No, that's for sure. So it kind of maybe came about by a providential path, and you came across finding out that this was something you don't mind doing. And
I love it.
Yeah, and so did you start doing speech therapy in home health, you said? Or
I did.
Yeah? And then from there you went to the district?
To the districts, yes.
Yeah, and then private practice. Okay, well, great. Now, regarding the techniques, you work a lot with phonetics, am I right?
I do.
And sound and word recognition, things like that. Reaction response, what do they call that? There's a term for it with 3 letters, I think it has. Like
Q&A?
Q&A, and it's something that requires a response. It has the letter R in it. But anyway.
Expressive and receptive?
Yeah, expressive and receptive.
Yes.
So tell us about the techniques you use and how you get them to communicate, basically.
Yeah.
Yeah.
There's so many. Every kid is different. No kid comes with instructions. So I wish they did. But they just don't. And every kid is different. So I've learned that being a mom and having a passion for children comes in handy. Because I'm passionate about what I do, and I love the children. So I use first and then. First, wash your hands. Then you can play with my toys. I've used first and then with, first we do our table work. Because believe it or not, some kids don't know the requirement to sit in a chair for an extended amount of time. So I do teach that. I want every child 3 years old to be able to sit for a lengthy amount of time, because that's preschool training. If I get a kiddo at 2 and 3 years old, I'm telling the parent, we're working towards preschool. We're working towards following directions. We're working towards building communication so they know what's required of them. And that's something you have to teach the parents too. Like, yeah, children are fun and we get to play with them, but if they can't follow directions, I don't want the teachers to be yelling at your kid all the time.
Mm-hmm.
I want them to listen and know what's the bar.
What's the underlying cause? Yeah.
So I teach sitting in a chair first, come and do some table work, then we can go onto the floor, we can play some games. What else? I teach loud voice, inside voice, outside voice, because kids like to scream a lot. And they like to talk really loud. They get really excited. What other techniques? Teaching the R technique. That's R's are really, really hard. So doing the ah and your tongue, teaching about your tongue, what it does. It's a muscle. It needs exercise. There's so many things.
Yeah, and I've seen. I mean, you do so much. You also do like recordings.
Oh, I do. I do.
And the videos. They tend to help because it's a visual representation of what the kid is learning, and sometimes that reinforces what they should be learning. So it sounds to me like, we talked about patience, but it sounds to me like you're working on patience with the kids, the sequence of things, having a structure, order of things, first this, then this, then this. And that's a lot of great stuff because it's stuff that even adults could use. I mean, it's like, I hate to say it, but sometimes we get so fragmented in our daily routine. And it really does, it sounds to me like it's a very healthy practice to practice that sequence and work with the order of things. So
it does.
Yeah. What are some of the challenges that you see in this job that you like to see some resolution to, perhaps?
I think some of the challenges I've seen with parents, young parents that come in and have they just need the help but don't know how to ask. So as a therapist, I'm coming to the parent. What do you see? What do you need help with? What concerns do you have? Like, there's a way to ask parents because they're coming to seek help, but also they're coming at the recommendation of a doctor or a school.
Right.
And sometimes those recommendations, parents come in and like, I'm here because the doctor told me to come. So then I have to find out, well, do you see what your doctor is seeing? Do you have the same concerns your doctor has? So helping the parents realize, yes, I agree with your doctor and this is why. And having the parent see, oh, okay, now I know what you're talking about. That's the challenge, because if parents don't realize the doctor sees something, so it's important, I need you to see it too.
Yeah.
That can be a challenge to, especially when your doctor may be seeing signs of autism. We don't diagnose that, so we're coming to have to say there are some concerns for autism. Tell me what you see, because that can be a challenge. And autism isn't anything to be afraid of. It's actually just your child learns differently. There's different ways your teacher's going to have to come about learning for your child for the benefit of their success. There are some challenges with a nonverbal kiddo that has some behavior issues. So behavior is something that I take on, and I'm so passionate about helping your child move through all of those emotions because they're very, very real. Your child is expressing anger, your child is expressing anxiety, and I take that on. I need to help you communicate through that. And so one of the ways that I do that is I try to induce that behavior and then use communication to talk them through that. And I had a very, very successful week last week with a parent that said, my child was experiencing some behavior and he did the breathing.
Mhm.
And then he touched his fingers, which is something we've been working on for about, I think, 3 months.
Mhm.
So 3 months, I'm having to induce like a tantrum,
Mhm.
and then show him model the behavior, and then do the counting. And 5, 4, 3, 2, 1, done. And so he moved through that himself for the first time. So that's huge. That's a huge success.
Fantastic.
A huge win for the whole family.
Yeah, yeah.
Yeah.
So the communication with the home, building that communication just in general, you're helping the child learn how to communicate better. Is the main subject area, and correct me if I'm wrong, but is the main subject area mostly with the language arts, the communication, or do you also touch on math and other things?
I do.
Yeah.
I have touched on math
Mhm.
because that's where we're experiencing the most anxiety for some kiddos. Reading has been a struggle for some kiddos. And then we're finding out because of dyslexia concerns.
Mhm.
So some kiddos will say the letters are moving. I don't see them. They're really blurry. Some kids need glasses. Some kids go through that dyslexia program. And then there's some kiddos that struggle with phonics and word morphology.
Mhm.
So there's a lot of concerns with math and reading right now.
Mhm.
That's really, really high. So I do the phonics thing where these 2 letters make one sound. What sound is that? And then I have them write everything because writing is connected as well. So I do that. So yes, there are other school languages, school subjects that we touch on.
Okay. So, talk to me a little bit as we try to get closer to wrapping up. Talk to me a little bit about the training to be in this job. What types of things does a person have to do? They take special ed classes, or what is the...
You need a degree.
Uh-huh.
You need a Bachelor's of Science degree in Speech and Language Pathology to be an assistant,
Mhm.
to be a speech language pathologist. You need a master's degree.
Which you're about to...
I'm about to pursue, yes. So,
Yeah.
So my degree required 2 years, 4
Mhm.
years because an associate and then bachelor's, and then the master's is a 2-year program.
Mhm. Fantastic.
Yeah. And then
So,
I think it's 2 years to be a doctor, so might as well.
yeah. No, I think that's wonderful because
Yeah.
you're really good at what you do. You really
I
are.
love it.
And
Thank you.
And I wish you the absolute best.
Thank you.
So, it takes a special dedication. It takes being positive. That's one thing I think I commented on right away.
You did.
Because I said, you're very positive.
Yeah.
And being a former teacher myself, I picked on that. I said, this lady just is positive.
You did.
And,
you did.
and it really, really just, it carries across.
Thank you.
And I know that Hannah and Mira have really benefited from that. But I guess the thing that I want to ask you is, being the channel that I am, I'm, Topics with Mr. Javadi, a lot of it is education related. I try to inform, educate, and serve is my goal.
Nice.
So, for those who are watching,
Yes.
and those who are wanting to go your path,
Yes.
they want to be in the job you are,
Okay.
what would be your advice to them? Because it takes a special person, I think.
Mm-hmm.
But, just give us the sort of the blueprint of what it takes.
The secret sauce.
Yeah.
Oh. It's been a fun adventure.
Mm-hmm.
Because it's like a box of chocolates. You never know what you're gonna get. It's always, every kid is different. So your creative mind, be creative, be spontaneous, and be willing to work with all types of children. And if you could step into this with an open mind of I'm going to help the families.
Mm-hmm.
You're helping the family communicate with their child. That you have to have a heart.
Mm-hmm.
That's the
Oh,
heart
yeah. Oh, yeah.
of this job. And it's not a job if you come into it as, I'm a part of this family. I feel I'm a part of your family.
Thank you.
And you build a relationship with the family through the child, and you become a unit together.
Yeah, yeah.
And that's what it's about.
You have to love it.
I do. You do.
No, I mean, for the person watching,
Yes.
you have to love it, because from
love
what I'm gathering,
Yes.
don't go into it like for the paycheck or for the job, or
Nope.
You have to love it, because there's a lot of challenges.
There's a lot of challenges, but you can overcome them, because when you look at this child, you're a team. You're a team. It becomes fun, and the child wants to learn from you. Yeah.
Well,
it's been fun.
Yeah, that's great.
Do it.
Do
it. We need you. We need you.
Good advice. Good advice. Thank you very much.
Thank you so much.
Really appreciate it. Thank you for your time. And this is Topics with Mr. Javadi. Thank you for watching.
Thanks.